Hannah Jacobus was employed in 2013 to oversee all NGOs in Gauteng. She says she only became aware that the Life Esidimeni contract would be terminated in 2014 and that was not immediately aware of the time frames that were given for this. Let's take a listen.
Ms. Jacobus, so it appears to me that regarding the issue of the NGOs, you were being caught by time.
Yes, for the expected time frame. And during at that stage, we still had sporadic meetings within our directorate. And not just me, but all my colleagues voiced to Dr. Manamela that the time frame is not suitable.
Jacobus also told the inquest that part of the process of admission should include how many patients can be accommodated at these NGOs and whether that facility can accommodate the needs of a specific patients. And she was also asked about the time frame of this move. Let's take a listen.
This question, if you look at this question, Council wants to know whether would you say that the time frame from December, when you were given this task, 2015, up to March or June 2016, would you regard that time frame as having been sufficient for you to be able to identify suitable and identify and appoint suitable NGOs?
No, Council, sorry for that, but no, the time frame wasn't sufficient. We needed more time.
Remember, there was also the controversial issue of the issuing of licenses, Nompu. Jacobus also denying that she'd issued any of those controversial licenses to those NGOs. She says hers was merely to recommend.
So the ultimate responsibility lay with Dr. Manamela, to whom you presented, if I can refer to as such, the file after the whole process has been completed and approved.
Yes, Council, with recommendations that we can issue a license or we cannot issue a license. And myself and Dr. Manamela will discuss each case, each report, or each NGO before it's being signed off in our directorate.
Now, Ms. Jacobus, in the present matter, with the NGOs involved, was this time-consuming process followed and complied with?
No, Council. There wasn't any process followed.
Clear indication that this process had been rushed, leading to the deaths of those mental health care users. Criselda Lewis, SABC News in Johannesburg.